Well, listening to that from his home, he's observing his own advice about not going out on a Sunday morning, is the Health Secretary, Matt Hancock. Mr. Hancock, welcome. Thanks for joining us. Can I ask, first of all, is the NHS close to being overwhelmed?
Well, the NHS is under very serious pressure, as the Chief Medical Officer said. It's true right across the UK, and we all can do something about it. You know, the NHS has never...
Your phrase has been in the past overwhelmed. How many weeks away are we from the NHS being overwhelmed?
We have to leave. If everybody does that, everybody follows the rules, then we should see the case rates start to come down. Andrew, depends on what people do at home.
So when we come to what that big word overwhelmed actually means, and we've had lots and lots of stories about what's going on inside hospitals, what would overwhelming the NHS actually mean?
Well, at the moment, even though it's incredibly difficult, piece about the NHS is that it is a promise to all of us that we in the NHS, colleagues right across the board, are working incredibly hard to across the board, ambulance services, like you say, people working incredibly hard to make sure that we expand capacity. We've built extra capacity this summer.
And doctors on their knees with exhaustion.
Clearly, the NHS got so much on, and this is why it's under so much pressure. The second is rolling out the vaccine now, but the large majority will be done through primary care, through GP. If you think about it, at this time of year, the NHS is normally under pressure, even without those two huge additional tasks. So, and it is working harder than it's ever worked before, and we can all do something to help. That could be fatal. And we all...
I'm sorry to jump in.
Well, I think the vast majority of people are following the rules. And it's not easy, as
compared to Marr,
the professor just said. It's not easy, but if you can do something from home to the studio, because you have a chance of a more in-depth interview somehow. But of the plethora of examples that there are of where people just need to not just follow the letter of the rules.
Were back in March.
Well, we don't know, because we do know that people are being more stringent than...
Well, and you do know, for instance, about traffic, and certainly there's been figures bandied around saying that the amount of traffic on the road...
There are signs that people are doing... Well, as I say, the data that we do have, in a way, the comparison to March, what really matters is that people do follow the rules, because we
have a new variant, and the measures are more lenient than they were age. If this doesn't get under control, what new measures could you introduce?
Well, obviously, we look at the data all the time. The very clear message is that people need to stay at home. The government rules only are one part of this. What really matters is how everybody watching this programme behaves, and how minimising the social contact.
And because you've said it so many times already, I do take it that you are worried about compliance. But of course, the government rules are also absolutely central to this. So are you considering, I'm not saying those are the kind of things that you could consider if you don't get this under control very quickly?
It is not whether the government will further strengthen the rules. The most important thing is that people stay at home. The important thing that we can do collectively as a society.
Who simply lose an immediate cash income as they stay at home, because not everybody is covered by your scheme.
And the IMF, for instance, has looked at these economic schemes and has compared them and has complimented. The Exchequer announced further support. Of course he did, because this is a massive national effort.
Who's been told to self-isolate for 10 days, an average worker. According to the TUC, that person would lose £690 straight away in earnings.
A partial way of looking at it, because we have the £500 support payment for people and are more likely to be in jobs where you're paid at full salary. And that's all about targeting support at those who need it most. So we're targeting support, absolutely. And and are most likely to find it difficult to follow the isolation rules. If you answer your own question, which is absolutely we have a targeted approach.
Enough accurate results?
They're the same lateral flow tests that worked effectively in Liverpool, yes, where the science is really clear, which is that we want to put testing in place, especially for those people. Really easy. They're easy to do, they're easy to administer, and the science on them is really clear. We published all of the data on how
60% of positive cases were missed by these tests, and the scientists reported back to you from Liverpool, they said less good news. They're simply not good enough.
But also that's not the assessment. And
well, it's from your own. It's from your own paper. It was your own scientists to you.
Liverpool. What happened in Liverpool was that testing as targeted as possible, and it only ever can be one tool in the armoury. I wouldn't identify them otherwise.
I've just read you your own scientists saying exactly the opposite. But let's move on. Let's move on to the vaccination programme itself. How many people have been vaccinated so far?
Over the last week, we've vaccinated more people than in the entirety of increasing.
How many? Can you give me a figure?
Well, it's around the 2 million mark, but we're going to publish the exact figures tomorrow, and we're getting to over 200,000 people a day is.
Your phrase to cry freedom and get out of that. That is over-optimistic boosterism. You have to vaccinate many, many more people down the scale, and indeed.
Yes. So we're absolutely going.
Everybody will be vaccinated by the autumn.
Every adult will be offered a vaccine by the autumn. Everybody. We've got over 350 million doses on order. They're not all here yet, and we're rolling them out as fast as they get delivered. But everybody will take that up. And the take-up so far has been absolutely fantastic. But yes, it's very important that, of course, we start with the most vulnerable, but then we get through and we vaccinate everyone.
Isn't it now the time to be absolutely clear with people about the criteria on which you will take that decision?
The second is that we obviously need to see the number of deaths coming down, concentrated in the most vulnerable group. More than 4 out of 5 deaths have sadly been amongst the over 70s and the clinic. I hope we can see the number of deaths coming down. Significant pressures on the NHS right now. It's always challenging in the middle of winter, but this and their carers and NHS and social care staff. During that time, we'll keep going down the age spectrum and all the way through to everybody over the age of 18. So that's the plan. Timings on when the restrictions can be lifted, but unfortunately, as you know, the middle of February, by February the 15th, our goal is to have offered a vaccine to everybody in the top 4 most vulnerable groups, which is
vectors of transmission. How can a vector of transmission be safe?
Well, I'm going to explain again, as he did on this programme last week. I think he was for adults. Around 1 in 3 people catch the disease. He was very clear about it. If you watch back to last week, Andrew, he was very clear about the spread of the disease, hence the decision that we've had to take.
It's just quite confusing to people if children are passing the disease around and causing more illness and ultimately more deaths. It doesn't seem very safe. Nonetheless, let's move on.
Do understand this, actually.
Okay,
there are 2 parts to it, though. So, to communicate it, it's for the children. So children of key workers still, contribute to the spread of the disease, hence the decision that
even longer across the rest of the country to reopen. Isn't that going to keep
children of key workers? Of course you do. And we've set the schools open so that NHS staff can to work and to look after people, to continue to run. People coming into work. I mean, the NHS would be under that schools do remain open for those key work. Well, what I would say is obviously the scenes clearly encouraged to see that, because
were you
making editorial decisions now? I think we should just be.
Say so. Matt Hancock, thanks very much indeed for joining us this morning. Now, during the first lockdown, the BBC